Hi, everybody. Um, you can see, I'm in a new spot in the house. Both kids are taking a nap, so we got to move locations here. But I hope you are all doing well. So this week we are talking about endocrine disorders. One of the main ones, of course, is diabetes. So take your time going through that. There's a lot of information, a lot of stuff to know as a provider. So just take your time with it, understand it bit by bit, how the medications are working and why they're working and why, what we pick them for. Another part of this week is the thyroid, which is another very important metabolic organ. And so I wanted to talk a little bit about an experience I had taking care of somebody with a thyroid dysfunction. So um, you may have remember the story. I may have told it in physical assessment, but I'm going to tell it again because I think it's just really worth remembering. So I this was in when I was in my family practice, and a patient came in. She was in her late 50s and she had seen the other physician that worked in the office with me, but this was my first time seeing her, and she had a previous PCP fairly recently in the last few years. So she's seen a couple people, and she was complaining of symptoms like sometimes she would just feel like really tired and run down. Other times she felt like she had a lot of energy. She would get palpitations. She felt really jittery, alternating sometimes with diarrhea for a couple weeks and then constipation for a few weeks, depending on what her symptoms were. Her skin was either really itchy and dry or it was normal. She noticed different patterns with her hair as well. It would thin and fall out, and other times it would just be like really coarse. So as you can kind of get the picture, she was going back and forth between what sounded like hyperthyroid and hypothyroid symptoms. So I said, okay, that's certainly the number one thing in my head going, the bells going off. So I'm looking through her chart, and thank goodness for electronic medical records, and I could see her thyroid panels have been drawn fairly consistently for the last few years because she would always present with, these complaints on either spectrum. And she's like, I think it's my thyroid, or I don't know what's going on. They've ruled out my thyroid several times, but I always ask them to check it and they can never find anything else that's wrong. So I'm looking at her thyroid panel, and there's nothing flagged or highlighted that anything is high or it's too low, like TSH wise. But I notice a pattern. She's always either very low normal or high normal, and she's bouncing back and forth. And if you think about it, like a TSH, a normal TSH is like roughly like a zero 0.5 up to like a 4.5-ish, depending on the lab. And she would go between like a 0.54 to a 4.48, back down again and back up again. So it was never flagged because technically she always had a normal thyroid, a normal TSH, I should say. So I showed her the graph, and I actually was able to, with the electronic medical record, show a graph of how her TSH is going up and down, but it's always within the normal limits. And I said, based on your symptoms, and just how much your TSH is bouncing around, even though it's considered normal, I would like you to see Endocrine and have them do some more blood tests and have them evaluate you and see what they think. I mean, you've seen primary care providers a couple times, and we haven't been able to figure it out. But I think this is what's going on. So I sent her to Endocrine, and they did like a full thyroid panel with the antibodies and all of that, and she was actually diagnosed with Hashimoto's thyroiditis. So yay for me for figuring it out. Yay for me for believing her symptoms and, not just looking at the paper, looking at the patient, listening to her complaints, her symptoms, how she was feeling, and taking that into consideration more than, what I saw on paper. So two things. Make sure you look at lab trends. Trends are so important, especially like with chronic conditions. I work in long-term care, so I'm always looking at renal function trends. You can look at liver function trend, anything. Kind of, it helps you look at the big picture and kind of see how they've been doing over a long period of time. So always look at lab trends. You can get a lot of information that way. And then also, second point, always listen to your patient. You know, if they keep coming back with the same complaints, try something different. You know, think outside of the box. Do something that somebody else hasn't done yet. And just, you know, make sure you're listening to them and not just looking at the paper or looking at what the computer in front of you says. Because the patients are what we're here for. So that's my story. That's my sidebar. Hopefully it's something that sticks with you. And please let me know if you need anything. I'm here for you guys. We're almost done. We're in the home stretch. Keep it up. You're all doing fantastic. I love the discussion boards. So anyway, take care, stay well, and I'm here if you need me.